Hi, Donica from Baby Steps Nursing again. Today I want to talk about congestion. I've been getting a lot of questions lately from new parents about their baby sounding congested, and they're worried about it and what can I do about it. They're asking about saline drops. They're asking about humidifiers at home. So saline drops are fine. If you think that there's something in there that's kind of stuck and needs to come out, you can use some saline drops in suction afterwards. Humidifiers are okay to use, but please, please, please make sure that you are cleaning them on a regular basis. Otherwise, they're just going to be spreading bacteria and fungus around. And with suctioning, if you're suctioning too frequently, you actually could be causing more congestion through inflammation kind of in the nasal cavity. So that leads me to really the number one cause, I think, of a lot of newborn congestion. It can be boogers. I mean, we all get boogers, but a lot of the time it's inflammation. It's inflammation way up in their nose. It does not mean there's an emergency, okay? So anytime that we hear a mom saying, my baby can't breathe, and we run in to make sure everything's okay, what we're looking at are a few things. One, nasal flaring, okay? So if their nostrils are flaring every time the baby's breathing in, that might mean that they're having to work a little bit extra to get some oxygen. If they have what's called retractions, I'm gonna show you here. You can see how the skin kind of comes in every time they breathe. It doesn't always happen in the neck. A lot of times it happens in their ribs. So the skin that's between each rib kind of gets sucked in a little bit every time they breathe. Those are called retractions. Also means the baby's working a little bit harder than normal to try and breathe. If the baby is grunting or wheezing, so when they're breathing, if they're going, if it really sounds like they're struggling to breathe, obviously those are signs that we're a little worried about. We want to have something checked out. The number one sign that your baby's not getting enough oxygen is, the technical term is circumoral cyanosis. So around the mouth, turns blue, gray, purple, some shade like that. If your baby has darker skin, it might just turn really pale. But the lips and around the mouth, kind of out here, turn this crazy color. It's a very unnatural skin color. You're going to take one look at it and go, oh my God, what's going on? It means your baby's not getting enough oxygen. If you see the circumoral cyanosis, if you see nasal flaring, if you hear grunting or wheezing, if you see retractions, that definitely is something you need to call your doctor about. If you're still in the hospital, call the nurse, have them come check it out. Otherwise, if those things aren't happening and your baby still sounds congested, it's not something to panic about, okay? If there is a booger in there, it'll work itself out, or it'll at least work itself down enough that you can get it with the bulb suction syringe. If it's not a booger, it's probably inflammation way back here up in the sinuses, okay? If you think about like a vaginal delivery, that baby just got squished through a very tiny tunnel. So everything might be a little bit swollen for a little bit. There's some amniotic fluid still kind of floating around. So don't panic about the congestion. If you see any other signs of difficulty breathing, definitely let somebody know. But otherwise, take a deep breath. See how your baby's doing. If your baby's eating fine, sleeping fine, everything else, then chances are it's inflammation and it's going to be fine, okay? As always, if you're really concerned or your baby's turning blue, call 911 immediately, okay? All right, guys, please send in questions. We're here to help. We want to make the transition home with your new baby a lot easier. We want you to be a more confident parent, and we really want you to enjoy it, okay? All right, talk to you soon.